You, everyone. Good afternoon. Thank you for joining us today. My name is Jeanette Beaudry, and I'm the Executive Director for Baltimore Family Alliance. Our mission is to support families living in Baltimore by connecting neighborhoods and communities, empowering families to advocate for great schools, safe streets, and vibrant neighborhoods. We are a membership organization. Membership is free and available to every family living in the city of Baltimore. You just need to claim your membership today. So today's program is our new babies on the block, and our topic is vaccinations and masks. We are so excited to have with us our host, Angelique Kane, and our guest speaker, Dr. Jeanette Beaudry. And I will let them tell you about themselves in a bit and their beautiful families. The last thing that I want to say to you all is that this program is actually brought to you by the Baltimore City Health Department and Civic Works through their COVID-19 Value Communities program, which aims to educate mobilized communities to get the vaccine when it becomes available to them. Value stands for Vaccine Acceptance and Access Lives in Unity, Education, and Engagement. Now I'm going to turn the program over to Angelique and Dr. Beaudry.
Oh, hello and welcome everyone. I just wanted to first thank you for joining us today. So just a little bit about myself. My name is Angelique Kane and I actually reside in the Ednor Gardens Lakeside community. And I live here with my family and my children. They range their age ranges are from 8 to 16. So I have always have some fun and lots of logistics and things to consider. And personally, I have all of my kids except for my 8-year-old is vaccinated. And professionally, I am a program specialist at the University of Maryland School of Social Work in the Parent, Infant, and Early Childhood program. And I am so excited to be here today. And I just want to give Dr. Beaudry a moment to go ahead and introduce herself. But first, I just want to let you know that I will be monitoring the chat. So if this is a very informal conversation, we're all here for the same reasons. We love our families and we want to make sure that we stay as safe as possible. So I just wanted to encourage you, if you have a question, you can either unmute or you can put your question in the chat, and I will be sure to acknowledge you. Please, feel free to. We are in Zoom, so feel free to use like the reactions. If you want to raise your hand, you can do that. If you don't want to raise your hand, you just want to unmute. Like I said, this is very informal. I encourage you to do anything that you need to do to take care of yourself and to make sure that your questions are answered. So at this moment, I will go ahead and allow Dr. Beaudry to introduce herself.
Great, thank you so much. So I'm Jeanette Beaudry. I am a pediatrician and I specialize in infectious disease. So I'm an infectious disease fellow right now at Hopkins. I live in Patterson Park, so Southeast Baltimore. And my husband and I live here with our 5 kids. So between, I think we were chatting beforehand, between the 3 of us, we have, I think, 14 kids. So our age range is 10 down to 11 months. And our kids go to public school here and we love it. In addition to caring about kids' health, because that's what I do professionally, I also care a lot about it because of my own kids. And I know that there have been some questions about vaccines in younger kids, and I am also with you in really, anticipating and looking forward to our kids being able to be vaccinated. And so, as they've said, I think I would really love this to be, a really informal session to be high yield for you guys. So any questions that you have, big or small, I'd love to chat about it in terms of COVID. So moving forward, I know that there were some questions that people asked and I'm happy to address those. I think they were sent in ahead of time. But if there are any burning questions, feel free to sort of raise them.
Oh, do we want to jump right into question and
Okay.
answer?
Yeah,
Do you
sure.
have something?
Perfect.
Okay, so during registration, you did have an opportunity to share questions. So I'm going to go through some of those questions, and we're just going to talk like, like friends. Right? So the first question I have is, are the antibodies from the vaccine passed through breast milk?
Yeah, that's a great question. So they've done a couple studies to look at this so far. And what we know is that it looks like antibodies are passed. So for people who may not be as familiar, so one of the benefits of breastfeeding is that antibodies are basically things in your body that fight disease. And it's like your body has already been trained against certain viruses or bacteria. And one of the benefits of breastfeeding is that antibodies often can be passed to babies through your breast milk. And so they specifically looked at COVID antibodies after both natural infections. So if you get COVID and have symptoms, and also after vaccination. And what they found is that it looks like there are antibodies, and especially when they look at it, there are different types of antibodies. And the antibodies that we know are protective for babies is something called IgA. For most viruses or bacteria that kids are protected against when they breastfeed, it's the IgA part of the antibodies that protect the babies. And so when they check mom's breast milk for IgA, what they saw was that they did see COVID-specific IgA, which is great. We don't yet know in terms of what that looks like in terms of the protection that you get from that specifically. But I think based on all of the other studies that we've done against the other bacteria and viruses, this is really encouraging and suggests that, it's a great idea if you're able to. It's one of the benefits of breastfeeding that it might be protective for babies. And I think the studies I've seen have looked out as far as, about 4 weeks after the second dose of vaccination for Pfizer or Moderna. So we don't have like longer term data yet, but that's very encouraging for any breastfeeding moms out there.
Oh yeah, it is. Thank you. And I've actually, because I've had multiple children, I was able to do all the things. I've breastfed, I've not breastfed, I've done mixed, so that's really good to know. So the next thing I want to talk about is, so first I want to say thank you so much for being here and giving like your honest insights about this. So one participant wanted to know, they heard Pfizer will present their data for 5 to 11-year-olds to the FDA at the end of this month. And then it'll be several weeks before vaccination will be approved for emergency use in the same age group. And news media reports say it'll be sometime this fall or early this winter or by the end of the year. And what exactly does that mean? This particular participant says he or she has their fingers crossed about their daughter who can be fully vaccinated by Thanksgiving, but also wants to have reasonable expectations. So what is the most likely date that this 9-year-old can get her first COVID vaccine shot?
Yeah.
So that's a loaded question. That's
$1 million question.
In there. Yeah.
I know it's $1 million question right now. And like, some of the people on this call also, I have school age children, and I know that it's been a hard time, just figuring out what to do, whether, whatever you've decided to do. I think everybody agrees that it's just a really hard time to make these decisions. And I know that many of us have been really eagerly anticipating being able to have our school children, especially like elementary school aged or early middle school, too young to be vaccinated right now. And the answer is we don't actually know yet, when those first doses are going to be, able to when we're going to be able to start vaccinating the 5 to 11-year-olds. I can tell you what we do know. So what we do know is that both Pfizer and Moderna are have both started the studies on both the 5 to 11-year-olds and also that younger age group from, I think, 6 months. I think they've gone down to up to sort of 4 years. The 5 to 11 will probably be approved before the 6 month to 4 years. And I think that probably Pfizer is going to be slightly ahead of Moderna based on when they started those studies in the summer. And, typically the pattern that, these typically follow is that they submit their data. It takes about 3 to 4 weeks for the FDA to sort of review the data, and then they come up with their recommendation. And that's sort of the pattern that's been followed for both the adults and then sort of that 12 to 15-year-old age group. In terms of what this is going to look like for the 5 to 11-year-olds, it's a little bit more complicated because the FDA sort of indicated that they wanted a little more data than what they had initially asked for. So I think they had asked for, initially 6 months of follow-up data potentially, or more children in the studies, both of which would take a little bit more time in order to be able to, collect that data. There have been a number of, people and organizations that have encouraged the FDA to take the approach of, giving the EUA, once they are able to review the data after the data is submitted in September with whatever, the original group was, and with the 2 months of follow-up data, including the AAP president who wrote, just basically saying that it would be really beneficial to have this vaccine, when weighing the risks and benefits, to have this vaccine available to that age group, and then to continue to follow up on, the extra groups, the extra, time in terms of looking at the 6 month follow-up. And the FDA, as far as I know, hasn't indicated what they plan to do. It does sound like Pfizer is still planning on submitting their data, and in terms of that original group of people, children that they were studying at the end of September. Personally, and this is just my personal opinion, I think that, given the Delta variant and, the increasing pediatric hospitalizations in many areas of our country, it's really increased the urgency of considering vaccination for our younger kids, and especially now that they're in school. We've seen a number of school districts that have had to close down because of outbreaks in their school. And I think that, that's kind of changed the conversation. And so hopefully I'm hoping, fingers crossed, that they do end up pushing this through by the end of, sort of October, which would put you in the range for hopefully at least getting that second shot in by the end of November. So fingers crossed, we will definitely continue to follow that conversation. But I think it's definitely, underlying all of that is, a lot of the struggles that we're all sort of dealing with right now in terms of thinking about, is my kid safe going to school, and all of the different procedures that are happening, and, when is my kid going to be able to be vaccinated? So I hear you on that, and share with you in that struggle.
Oh, thank you. I really appreciate that, especially with a lot of people, like this, the last question addressed. A lot of people are thinking about like having the Thanksgiving travel and so forth. And kids are back in school. And even if it's not that the school age children, they may have younger siblings in the home. So that's absolutely something. So I do see something in the chat that I will pause to go ahead and address. What's your number one thing you want parents to know about COVID-19 and kids from your research field of work?
Yeah, I think what I want people to know is a couple-fold. So I think one thing, when, heading back to the beginning of this pandemic, I think one of the things that, clearly as a mom, I was concerned about was, how is this going to affect my kids? And clearly we've seen that sort of play out over the course of the last year and a half. It's affected our kids in many different ways, both in terms of their physical health, but also, in terms of their schooling, in terms of their mental health. It's affected them in so many ways. But I think, one of the big things that we were happy to see at the beginning of the pandemic is that the course in children seems to be milder than in older people. And we know that, from a year and a half of data, we know that that's true. I think, at this point with the new, and I think something that has been said many times is like, kids aren't really severely affected. Kids aren't severely affected. Kids aren't severely affected, which is, percentage wise true. And in comparison to older adults is true. And I think, I think that one thing that I think is important to say is that we are glad that kids, when they get sick with COVID, tend to have a milder course. I think that the conversation, now though, in the era of Delta and the start of school is that kids can still be affected and they still can get very sick from COVID and can, require hospitalization or even ICU level care. And I think, that's not to say that I think school is super important, and getting kids back into school is, I'm glad that schools are back open in person and that our kids are able to go back into school for a number of reasons, including academic and social and mental health reasons. But I think that it's important to not let our guard down. And, I'm really glad that in Baltimore, we've actually not seen the levels of transmission or COVID that other places in the country have seen. And I think it's really been wonderful that, when you look at the numbers, many places have had peaks as high or higher than even in the winter, which is typically when, respiratory illnesses like COVID are, spread most frequently. But in Baltimore, this last Delta peak, it looks like it's plateaued now, and it looks like it's quite a bit lower than that peak. So I think that, really Baltimore has done a really good job overall. And I think that that really speaks to, that many people have really taken this seriously and have taken mitigation measures and have gotten vaccinated. But I think it's, that it's important that our kids are able to connect with other kids, to socialize, to do all of those things, get outside, but that we still need to take COVID seriously. And, we're in the hospital, we see primarily children who, apart from the acute illness, several weeks later have misc-C, where they have inflammation in their body after COVID. And so I think it's just important to say, most kids do fine, but we still need to protect our kids and to make sure that we take this seriously.
Thank you. And you brought up a really good point that I wanted to ask. Specifically, you mentioned that children tend to have a milder course. And could you kind of explain that? Could you discuss that a little bit more? Like, what is a milder course? What exactly does that mean?
Yeah.
And are the symptoms the same?
Sure. Yeah. So that's a great question. So in terms of, how children usually present with COVID, so many of their symptoms tend to be similar to adults. You can have cough, you can have fever, you can have, difficulty breathing, you can have loss of smell and taste, although those seem to be, and it's a little bit hard to say whether this is because of their age or just because it's harder for them to sort of describe it, but oftentimes, that seems to be a less prominent symptom in our younger kids. And, in terms of a milder course, when you look at the percentage of people who end up requiring hospitalization, require ICU level care, or end up dying from COVID, the percentages are much lower in children. So that's fantastic because, if our kids get it, we want them to have a more mild course where they're able to be cared for at home. It still can be pretty miserable. And I think that that's something that, many people have kind of noted is like, we call it a mild course, which means that you don't have to go to the hospital and be admitted for COVID, but you can still feel really terrible and still, it can really affect your ability to sort of go about, even getting up to get your food and everything, and you can have lingering symptoms. So, when we talk about a milder course, yes, it's milder, but it still is, can be pretty miserable. And the second part of your question, sorry.
Oh no, that was actually it. I just wanted
Yeah,
to fully understand like what milder course is. As you're talking, it makes me think about a point in not last school year. So when I say last school year, I'm always thinking about like the last time that they were in the building.
yeah,
But it reminds me of a time when my own son actually was being sent home from school because he was having trouble breathing and he kept coughing and we could not figure out what it was.
yeah,
And was told, I mean, his all of his other activities kind of seemed pretty normal, but it was just like he really was having a hard time breathing. And I have children who have asthma, and he seems very asthmatic, but still has not been diagnosed with asthma. So,
hmm,
I joke all the time, like my youngest son probably already had it, but that's one
yeah.
of the things but I just wanted to take a step back and and it seems so basic, but can you even just talk about the science of a vaccine? Like, what does a
Sure.
vaccine mean? And I mean, just can you walk us through it? Because,
Yeah.
my relationship with vaccines is, and I have a different approach. I kind of really lean heavily on what my pediatrician says,
Yeah.
you know. So if you could just explain it to me, because there are some things that I thought I knew before, but then, over the last year and a half, um, I, I've had to second guess myself. Like maybe I
Yeah.
really don't understand what the
Yeah.
vaccine is. So continue
Yeah.
with that.
Of course. Yeah. Well, a couple of things. First, I think your pediatrician is always a wonderful source of information. And I would encourage, when you guys have questions, I'm happy to, to chat with you. But definitely for individual situations or any lingering questions, I'm a pediatrician at heart. And so we absolutely want to answer your questions. We want to talk to you about this. We want to, make sure that you feel comfortable with, the information. And we were kind of discussing beforehand, about my niece who had the opportunity to get vaccinated, and her mom called me and was like, you need to talk to her because she doesn't want to get vaccinated. And so I chatted with her, and it turned out that she was willing to get vaccinated. She just had questions that were unanswered. And I think that, we should be able to answer your questions. So absolutely talk to your pediatrician. I think the second part is in terms of how vaccines work. And so that's a great question. Vaccines are essentially ways to train our body in order to fight different viruses or bacteria. In the case of COVID, it's a virus. And the way that vaccines work is that you present to the body something that looks a lot like the virus. So sometimes it's a protein or a part of the virus, but in a way that's safe. So in a way that doesn't cause, the actual disease, but trains your body so that when your body sees that piece of the virus again, it knows how to attack it. And so your body develops something called antibodies, and it develops something we call memory. So the next time it encounters it, your body is ready to ramp up their disease fighting abilities. And so, it mimics the way that our immune systems work, because when our normal immune system, when it sees, a bacteria or a virus multiple times, it has this ability to sort of see that virus or that bacteria, and it's already prepped and ready to have its sort of virus or bacteria fighting forces. And so that's what the virus does. In terms of the mRNA vaccines, the Pfizer and Moderna vaccines, the mRNA is just the technology that they've used to make this vaccine. And so sort of going all the way back to high school biology. So you have your DNA, which is sort of the building blocks and sort of the code, the blueprint for all of your body, for your cells. It tells your cells what to make and how to organize. And your DNA is turned into something called mRNA, which then is turned into a protein. And I think it's important to say your DNA is sitting in the center of the cell in something called the nucleus. And then once it turns into mRNA, it's in the outside of this, outside portion of the cell called the cytoplasm. So it never is inside the actual nucleus or where your DNA is. So it's sort of separated. And so the way that the vaccine works is this mRNA, you inject it, and it trains your body to make something called the spike protein, which is found on the outside of COVID, the SARS-CoV virus. And so basically the next time your body sees COVID, it's able to fight it. And so it's really pretty a clever way to do it. I think there's been some question about, this is a new technology, and it is a newer technology in that this isn't the traditional way that vaccines have been made in the past, but they've actually been researching it and using this in the development of various vaccines, ones that, haven't quite made it to, common use, but it's a technology that they've been working on for a long time. And I think, there's question about the mRNA sort of changing your DNA. And as I talked about, because it's mRNA, it stays in that outside part of the cell and it never actually goes into that inside part, the nucleus where your DNA is. So it can't change your DNA. The mRNA, actually, one of the questions about it was, is this going to work? Because mRNA is, it is what we call degraded. So it doesn't last very long in your body, like minutes. It usually, you have DNA, it turns into mRNA for a very short amount of time, like minutes, and then it turns into protein, which, sticks around. And so I think it's important to, just say that you don't have the mRNA sticking around in your body for years or anything like that, and it doesn't change your DNA.
Thank you. And I think the next question actually rolls right into what you were just speaking about. So the Delta variant may make some people feel like there's no point in getting vaccinated. Can you speak to this point of view? And I think we have something in the chat too. So I'll get to that. I just want to acknowledge that. But I wanted to ask you, especially as you're talking about the mRNA and, how it lasts for, temporarily, right? Can you speak to how that relates specifically to the Delta variant?
Yeah. So, I think there's been a lot of questions about, what is the point of getting vaccinated? I've heard that there are breakthrough infections, but I think the big message I want to say is the Delta variant should make us absolutely, if you're not vaccinated, now is the time to get vaccinated. And so backing up a little bit. So, I think everybody's probably heard of the Delta variant. Everybody knows that that's the predominant variant circulating right now, and that's what's responsible for the big uptake we've seen in cases. So I think, over the summer, I think we were all hopeful that things had calmed down, that, we would be opening school back up and things would look much better. But with the rise of the Delta variant, it's more transmissible. So it's easier to pass from person to person. And so we've seen an uptick in cases. The other thing we've seen is that previously the vaccine was really, really good at protecting against not just severe infections, and which means hospitalizations and death, but also was really good at preventing even person-to-person transmission and also infections. So you were less likely to be infected with COVID. And what we're seeing a little bit more now is that we are seeing some breakthrough infections. The current numbers that I've, in terms of the latest studies, have shown that you have like a 1 out of about 5,000 chance per day of a breakthrough infection. Some people are like, well, then what's the point of getting vaccinated? The point of getting vaccinated is to protect yourself against severe COVID. So, severe COVID where you need to go to the hospital, you end up in the ICU, or you end up dying. And so what they found is that, when you look at the percentage of people who are getting admitted, most of the people who are getting admitted, 90% plus, are people who are unvaccinated. And so the vaccine has been really, really protective against people having to be admitted. I do think, with the Delta variant, we have to be a little bit more careful, especially since many of us have children who are not vaccinated yet, because it's not quite as good at protecting against transmission. You are still able to, in some cases, transmit to other people. And so I think it's important just to be mindful of that. But absolutely, we want to protect, we want to protect, parents too, and all people. And so I think it's important to still get vaccinated. I think, even though we want to be careful about, protecting, being careful about exposing our children, even getting vaccinated is still a good way. And one of the things we can do to protect our kids, because it still reduces it. It just isn't quite as good as it was against some of the other variants.
Okay, thank you. So I wanted to ask the question in the chat. Does the summer RSV outbreak have any relation to COVID, or is it just the flu? And even just taking a step back, can you explain what is RSV?
Yeah, great question. Yeah, so RSV is a virus, and for adults and for older kids, most of us wouldn't know if we had RSV. For us, it's very much like just a normal cold. You might have sniffles, you might have a little bit of a cough, you might not feel super well for a couple of days. But when we were talking about immunity, it's a really common virus. And so all of us have seen RSV many times in the course of our lives. And so our bodies are sort of trained to see it. And so it's able to handle the virus pretty well. However, for little babies, especially, in that sort of like less than 6 month old sort of babies, they haven't had the chance to see RSV before. And so they can get really sick from the first time that they see RSV. And so they can get something called bronchiolitis, which is where they have oftentimes difficulty breathing. Their oxygen levels in their blood can sort of drop. You can see them breathing really quickly, or it can even cause them to have pauses in their breathing, which can be really scary for a 2-week-old who is having these pauses in their breathing. And so normally during the winter, we see a lot of babies. During the respiratory season, we see lots of babies who end up needing to be admitted to the hospital for some support. And typically it's a virus, so antibiotics aren't helpful. And so it's really supportive care. And so usually we give them some oxygen, we help them, because oftentimes when you're breathing that fast, it's difficult to eat. And so we end up having to help them get some nutrition for a little bit. And so over the last year, in the winter, we saw almost no RSV. We actually saw no flu, basically, and very little other, in terms of other, cold kind of viruses. We saw a little bit of something called rhinovirus and enterovirus. But, for the most part, our hospitals did not have the same numbers of children with RSV or flu that we normally see. And we saw a big uptick, especially in the southern states, but also in Baltimore. We saw increasing, higher than normal rates of RSV in the spring into the summer. I think it's connected in the sense that we didn't see RSV and flu this past year in the winter because everybody was still masking and keeping their distance, and things, kids were, many kids were not in physical school. And so a lot of the measures that we were taking to protect ourselves and each other against COVID were protective against transmission of RSV too. So we just saw much, much less RSV and flu. And then in the spring, when things sort of opened up a little bit more, I think that's when we started to see the transmission of RSV. And so I think it's connected in that way. I think it's a good question about, what's going to happen in the winter, this winter, because normally it's a winter, sort of virus. And we're anticipating that potentially, just like we saw an uptick in COVID last year, we may see a similar uptick again this year. Hopefully not, now that we have, vaccines. But, I think that's something that we need to be prepared for. And so, we, as Many of the children's hospitals have been, really at capacity in the southern states, and even in our hospitals in Baltimore, over the winter months, it can get quite tight in terms of beds. And so I think, one thing we want to just be mindful of is we want to try to keep as many kids out of the hospital as possible by keeping them healthy so that we don't overwhelm the hospital system.
Thank you. And then I wanted to ask a question that was submitted, and it's, can breakthrough infections affect my vaccinated baby? And then I want to add a layer to that also and kind of say, what can I do to protect an unvaccinated baby?
Yeah, great question. So I'm assuming this is like not a pregnant woman. This is like a baby who is already born? We can talk about both.
Yeah,
but
because that is the next question. So you're good.
So,
you're good.
So let's start with a baby who's already been born. And so mom is vaccinated or dad is vaccinated, or somebody involved in the child's life is vaccinated and they have a breakthrough infection. So if you have an infection, it can be transmitted. And one thing that we're sort of figuring out with the Delta variant, and something that people are investigating, is how likely is it that you would transmit if you're vaccinated versus if you're not vaccinated and you have an infection. And that's not entirely clear. I know that there have been some studies you may have heard that have looked at, how much virus you can see in the nose of people who are vaccinated versus unvaccinated who both got sick. And it looks like there's similar amounts of, virus that they're able to detect, but what they were measuring wasn't live virus that's able to necessarily, it can't distinguish whether it's a live virus versus a virus that was there and it's left some of its DNA there. And so it's a little bit unclear right now, but certainly we know if you're sick and you have COVID, you're definitely at risk for transmitting it onto other people. And so I think it's important, especially now that, I think people, because for a little while, if you were vaccinated, the likelihood of you having a breakthrough infection was pretty low. And so people sort of became less worried about getting tested with, sort of cold-like symptoms and thinking like, oh, I probably just have a cold. I think it's important to say, I think one way that we can protect, our kids who have not been able to be vaccinated is to test often. Any sort of symptoms that could be COVID, it's worth getting tested. Because, I think it's important to not just say like this is a cold, because COVID can have cold-like symptoms, and especially if you're vaccinated, we hope that you have a mild illness. And so your only symptoms may be a cough and like a runny nose and just not feeling like yourself for a couple of days. So get yourself tested, and in the meantime, you can mask and protect your baby in that way, and sort of as much as possible try to not get up in their face, and sort of share that breathing space. But I think it's important to say it's still good to be vaccinated, because that'll decrease your chances of getting sick, and so decrease your chances of giving it to your baby. And then switching over to pregnancy, I think one question people have is, is it okay to get vaccinated if I'm pregnant? Mm-hmm. And I think very early on, I was actually, I was pregnant when the pandemic hit. And so it was unclear when we were going to have a vaccine. But certainly that was on my mind. Like, is this a safe thing to get when you're pregnant or when you're breastfeeding? And initially we weren't too sure, because the pregnant women and women who are breastfeeding weren't included in the initial studies. But now we have much, much more data since so many people have been vaccinated. And what they found is that it's safe, both for pregnant women, for women who are breastfeeding, for women who are thinking of becoming pregnant or trying to get pregnant. It's safe. And it's actually really important and good to get vaccinated, because pregnant women are at increased risk for severe complications of COVID. So including preterm labor, needing to go to the ICU, needing to be intubated, and passing away. And so there have been some really tragic stories in the news of pregnant women who have hesitated to get vaccinated because they were concerned that the vaccination could harm their baby. But then because they got COVID, they unfortunately passed away. And so I think it's important to sort of message out that now we have this information, and pregnant women absolutely should get vaccinated. There's also evidence that it may protect babies against, your unborn baby.
Thank you. That was going to be my next question.
Yeah, there isn't great evidence yet, but there is some suggestion that there may be some protection. And hopefully we'll have more information in the weeks to come. But we certainly know so far that it's safe.
Thank you. The next question is, do the flu and COVID vaccines need to be administered at least a month apart when they are ready for children? Or is that just a rumor?
Right now, well, so I think we'll have a little more information because we're just heading into flu season and we don't have the data for our kids yet. So we'll kind of see what happens. Right now, and let me just double check, because I don't think that there is any sort of indication for holding back on the flu vaccination with COVID. There may be guidance, specifically for that age range once they, sort of approve it, because hopefully we'll have a vaccine within the time frame that people are still getting their flu shots. But as far as I know, I don't think right now there's any sort of guidance to separate it by month, but I will double check on that.
Thank you. And our next question is about masking, and specifically masking in school and preschool, because we know that so preschool and childcare, because we know that a lot of times guidelines and regulations will kind of exclude children under 2. So what do you want to share with everyone about specifically masking in childcare, preschool, and K-12?
Yeah. So I think masking. So I think when we think about keeping everybody safe from COVID, there's a number of different. We like to think about sort of multi-layers of protection. So one layer, and I think we hope that everybody who's eligible for vaccination will go get vaccinated. And clearly that doesn't apply to our younger children, but hopefully teachers and staff and all the people who are sort of interacting with their kids, and also just people in the population, to bring those rates of COVID down, and to keep the adults who interact with our kids from having COVID. So I think that's the first layer. The second layer are things like masking. And so since our kids since kids under 12 aren't able to be vaccinated right now, I think, and with the current levels of transmission, which are still quite high. So Maryland and specifically Baltimore City has done better than the rest of the nation, but we're still seeing like substantial to high transmission in Maryland. And so it's important to include masking as part of our multi-layers. So masking, they did a study, I believe in Bangladesh recently, and it was this huge study where basically they had different sort of villages. Some of them they basically pushed masking, and others they didn't. And what they found was that masking was protective. It decreased the rates of infection and transmission. What we know from last school year was that schools could open safely even when there were high rates of transmission in the community, by doing things like distancing and masking. And clearly things like distancing are a lot harder this year because many schools, including ours, last year they split everybody into 2 and they were doing half days. And so you didn't have a whole class in the classroom. We live in Baltimore City where class sizes are quite large, and oftentimes, the class size itself, in terms of the classroom is not huge. And so, many of the kids aren't able to be spaced the same way that they were spaced, last year. So it's especially important that they're masked because that prevents twofold. So the person who's masked, if they're sick, it prevents them from spreading their illness. And there's also some benefit for the person who is not sick yet, who doesn't have COVID yet, to prevent them from getting sick as well when they're masked. And in terms of the protection they receive, it varies based on the type of mask they're wearing. So, everybody at minimum, hopefully, is wearing a cloth mask, but there are other types of masks that do a better job at protecting the person on the receiving end from getting sick. And so there are things you might have heard of, KN95s, and there's the KF94s, which is like the Korean version. And so they are a little more protective for the person who's receiving, who is not sick yet and is trying to protect themselves. So, I think as much as possible, masking, distancing, good ventilation, HEPA filters where possible, or spending time outdoors instead of being indoors, especially where people have to be unmasked, is really ideal.
Okay. And what some of the information we know about COVID, it just keeps changing. It changes, and that's no one's fault. It's just the nature of the beast, right?
Yeah.
But how do we know what to believe, who to believe? Who should we listen to get the most updated information? Who should we be listening to?
Yeah, that's such a great question. And it's so true. I think one of the challenges is that, we didn't know anything about COVID before 2 years ago, right? December 2019 is when this all started. And before that, COVID didn't exist. And so I think what everybody's sort of getting a view into is how our knowledge about a new virus changes over time. Because at the beginning, nobody knew anything, right? And it's really challenging because what we thought we knew is now not true, and I think that has been something hard for, everybody to sort of deal with. At the beginning of the pandemic, first, people were saying no masks, and then we were saying put on a mask. And, so I think that is really challenging, but it's how we sort of, as we learn more and more about, we use science to learn more and more about new viruses or about vaccines, our guidance has to change because we don't want to, base what we're telling people on information that's out of date. So I think, in terms of where to get your information, I think one place is, the CDC or the WHO. So your government agencies, or in the case of the World Health Organization, your international agency that is filled with people who are dedicated to public health and who are, looking at the research that everybody's doing and, kind of taking all of that information and coming up with recommendations that are based on the information that we have, the most up-to-date information. So I think that's the first place to sort of start with. I think the other places to go to are your doctors, your pediatricians for your kids. That's our job, to stay up to date on information and to read, the latest studies and to be in contact with each other to stay up to date on what's going on. And I think that's our job, and we love to talk about, to talk about your child and how different things will affect your child and what our recommendations are. So I think they're a perfect person to go to with all of your questions. I think in terms of, evaluating when you're looking at, YouTube, or you're looking at, something on social media, there are a number of questions to sort of ask about, how do I know that what this person is telling me is actually real or not? I think one thing to look at is, what are their credentials? So sometimes people, are, giving information about COVID or about the vaccine, but they don't have, even a medical background, or they have a medical background, but it's in a field that's really far away from infectious disease. So they might be, a surgeon, or they might be, a radiologist who looks at, your x-rays. And so, they're really important physicians, but their expertise is different than somebody who spends their time studying, infectious diseases or takes care of children who are hospitalized with COVID. And so we just have different expertises. I think another thing to look at is sort of what are the interests of the person who is giving this information to you? Are they, when you look them up, are they part of an organization that's specifically, trying to promote, is against all vaccines? And so, you already kind of know that their viewpoint is probably going to be that, COVID vaccines are bad if they think all vaccines are bad. And so investigating that and making sure that you sort of have that background on them. And then, in terms of the research itself, we spend years, as scientists and as doctors, learning how to look at studies and to sort of evaluate them. And so I think it can be really hard sometimes when you hear about a study to be like, is this a good study or not a good study? Some of the things that, sort of tip you off about, sometimes studies, aren't really well done is, the journal that they're published in. And so we typically something called a peer reviewed journal. So what that means is like, if I have research that I want to tell everybody about, there are certain journals where I have to have one of my peers or two of my peers usually review what I've written and what I've done and make sure that my methods are solid and that the conclusions that I'm drawing follow what I've done. And so those are the journals that we want that have like the best sort of quality. There are certain journals that are sort of the top tier journals that typically like the highest quality sort of research gets done in the biggest studies with the best controls. And so things like the New England Journal of Medicine or JAMA or the Lancet are sort of these big name journals that typically are trustworthy, although it's important to note that they've had to retract some of the studies that they've published because on further review, they've realized that there were things wrong with the study. So I think looking to make sure that it hasn't been retracted is also important. And then I think, in terms of, COVID specific resources that I like, I think that there's something called Dear Pandemic, and I can put it in the chat, which has really great sort of lay, person on the street. I don't know anything about science or about medicine. Tell me about, different topics related to COVID. And they do a really nice job of sort of going through and explaining what the studies and, why it is we know what we know and why their answer is what they're saying it is. And so I think it's a really nice resource. I'll put in the chat, Dear Pandemic, and I can give the website as well. So I really like that. There's also something called your local epidemiologist, and that one is also really good.
Thank
I
you.
can put the links
Thank you.
as well.
Those are all really good resources, and I want to say thank you for that. And the final question I want to address, and it's definitely not least, but it's just I'm just asking it last. So we know that some people don't trust the medical profession, specifically because there have been issues in the past and present where there has been misinformation and maltreatment of for Black and Brown people. So this is, and we know this is a real and legitimate concern. So how do you weigh this hesitancy with the public health pressure to get the vaccine for someone who, they've gone to Dear Pandemic, or they've gone to your local epidemiologist, Substack.com. They have hesitancy about WHO or the CDC. What do you say to that person because of those types of concerns?
Yeah. So I think, this is really a real problem. And absolutely, I think we, unfortunately, in this country and worldwide, we have a history. There's a long storied history of, where the medical, the medical field has not treated Black people and Brown people well, and have done things like Henrietta Lacks or the Tuskegee study, where people have been taken advantage of. So I think it's really important to acknowledge those things, and to say that those are legitimate concerns. I think the other thing that's important to say is that I think, as a pediatrician, my job is to care about all children. And I want to see every single child who comes across, in my panel, who I see in the hospital, to be as healthy as possible. And so that's really, as as a single person, as a pediatrician, that's what I care about. And so when I have a patient who comes across, who comes to me and they have these concerns, absolutely, we should talk about that. And, it is something that happened. I think in particular, the COVID vaccine, I can say that, I've been vaccinated, and that, personally for me, looking at the data myself, I absolutely want to get a vaccine because it's the safest thing I can do, or the biggest thing I can do to protect myself, and to protect the people I love. And so I think it's important to, as a doctor, to, I don't want anybody to be sicker than they have to be. And so I want to see, if you unfortunately come into contact with somebody who has COVID, I want you to not get sick. That's my first, the biggest thing I want. And the second thing I want is, if you do get sick, to have a mild course. So you don't need to go to the hospital. You don't need to be admitted. You don't need to go to the ICU. And, I think I can share that among, sort of my pediatrician friends, that all of us have gotten vaccinated. I don't know a single pediatrician friend of mine who hasn't gotten vaccinated and who isn't planning to vaccinate their own kids. And I would never suggest, anything that I wouldn't do for the people I love.
Thank you. So in our final moment, I want to first thank you for this important conversation. I want to thank everyone who submitted questions, and everyone who came to attend. And we want to say thank you. I did notice that there is a survey form in the chat. We ask that you go ahead and complete the short survey, just to let us know how we're doing. And if you have any questions or any concerns that was not addressed here, I do encourage you to please email us at info@baltimorefamilies.org. If you have any further questions or anything else that you would like to know.
And just to follow up on that question about the flu vaccine, currently there's no recommendation to space them. So as far as we know, based on the studies that they've done, it looks like both the way that your body responds to it in terms of developing antibodies and developing your immune response, and then also in terms of safety, it looks like, whether you have two vaccines that are given at the same time with COVID and another vaccine, or if you space them a little bit, that it looks like those things are the same. So the recommendation is to just get vaccinated whenever you can.
Thank you. And we are at time. So I just want to say the survey will take less than 3 minutes. We promise. We promise it will take less than 3 minutes. So please go ahead and complete that. And if there isn't anything else, then I will officially end the conversation.
Perfect.
Thank you, ladies. Thank you so much. Have a great and wonderful weekend.